I'm Bruce Vernon, I'm Chief Technical Officer at Calcivis, and today I'm going to talk about the Calcivis imaging system and the role of bioluminescence in preventive dentistry. The Calcivis imaging system will allow dentists for the first time to be able to visualize active demineralization. So this is on the enamel surface, and the reason we want to do that is because early identification of this demineralization allows the dentist to take a preventive approach to managing caries and erosion. The other large benefit is that it helps with communication with patients. A picture tells 1,000 words. The images themselves are a very useful means of communication with patients and allows the patient to understand the reason why a dentist might be taking this preventive approach. So to understand the relationship between bioluminescence and preventive dentistry, we first have to explore what bioluminescence is. So bioluminescence is it's a naturally occurring phenomenon, and quite often we see this in marine organisms where they're producing these tiny flashes of light. And the way this works is with photoproteins. So the organisms have photoproteins which react very specifically with calcium ions, and when they have this reaction they give this tiny burst of light, and that's what we see in nature. So these little bursts of light from these organisms due to a reaction between photoprotein and calcium ions. How does this relate to preventive dentistry? Well, when we think of the enamel structure, it's made predominantly of calcium-based crystal structure. When that crystal structure is attacked by acid, now that acid may be in the form of acid produced by bacteria in plaque, or from environments such as food and drinks, fizzy drinks, acid drinks, etc., we start seeing a breakdown of this crystalline structure. And what happens is the release of calcium ions, and this causes the breakdown of the structure, which forms little pores where the calcium ions can sit. The good news is, if we can pick it up early enough, we're able to repair that enamel surface using remineralisation therapies. What we've done at Calcivis is we've harnessed the power of these photoproteins by generating our own synthetic version. So our synthetic version of a photoprotein reacts very specifically with calcium ions, and it will be these calcium ions that are released during that demineralization process. So what happens is when we apply the photoprotein to the tooth surface and it comes across the free calcium ions that's been generated by this damage, we see this tiny flash of light. It's important to note that this is not the classic fluorescence that we see for other detection devices. This is a pure chemical reaction between the calcium and the photoprotein which produces this light. So there's no excitatory light, it's just a reaction between the photoprotein and calcium. And the other thing to note is that calcium that's bound in the crystalline structure, where it should normally be, doesn't give a signal. So we're only seeing a signal when the calcium has been released from that crystalline structure and it's in its ionic form. The way the camera is used, or the imaging device is used, is that the healthcare professional will hold the camera over a patient's tooth of interest. There'll be a live video stream so that he or she can position it correctly, and then at the press of the button, what the camera does, it takes two images very, very quickly. It takes a first image with a little light on that shows the structure of the tooth, and it takes a second image while the light is off and the photoprotein is being sprayed onto the tooth surface. And what happens is it takes a second image in the dark, and the only light then is from the reaction between the calcium and the photoprotein itself. And then the system will combine the two together, and what we see is a blended image which shows the background visible image and the luminescent image superimposed on the top of that to be able to identify areas of hotspots of demineralization on the tooth surface. Once the button is pressed to take these images, the whole process is very quick. It's less than a second from the point of pressing the button to being able to visualize the blended images. So it is a genuine, real-time, chairside imagery for the patient and the dentist to see. The resulting images provide a demineralisation map of the tooth surface. So what we're seeing are hotspots where there's high levels of calcium ions. So these are a result of demineralisation. So what the dentist or the healthcare professional is able to see is identify areas on the tooth where there is the active demineralisation occurring. Calcium is released as part of this demineralisation process as a response to attack from acid. And what we see in this series of images is that as that acid challenge increases, so the calcium loss increases, and therefore the greater the signal. So in this series we can see that it's a time challenge series where we've exposed the tooth surface to acid for longer and longer periods, and we get a greater and greater signal. So we see a clear correlation between the acid erosion that's taking place and a stronger signal as we increase the acid challenge. Calcivis imaging system has huge potential for monitoring remineralisation therapies. And what we've shown in this series of experiments here, where we've taken enamel and embedded it in a resin block, and we can image the sound enamel and we see no signal. And then we image it again after it's been exposed to an acid challenge, which is equivalent to a bacterial plaque. And we see quite a strong signal here. The remarkable finding is that that signal persists even once the acid challenge has been taken away, which is indicating that there is still some damage occurring. And the only way we seem to be able to repair this is by exposing it to a remineralisation therapy. So we've taken blocks that have been damaged by this plaque equivalent acid. We've then exposed them or treated them through a remineralisation process, 100-day cycle remineralisation process, image them again afterwards, and we see the signal disappear, which is a great way of showing that the effectiveness of these remineralisation therapies. As well as looking at acid erosion, Calcivis imaging system is extremely good for identifying active lesions, and particularly where they may have been missed in the routine examination. So there's a nice example here. This came from one of our clinical studies where the dentist was asked to highlight the area on the tooth that they were concerned about, where they thought there was going to be active demineralisation. And then we went ahead and imaged, and what we find is that yes, in the area that the dentist had pointed out, there is activity and there's active demineralisation, but we also see that it's far more extensive than the dentist felt it was. So if we look on this example, we can see areas of luminescence indicating demineralisation beyond the area where the dentist was concerned. What we've done is we've undertaken a series of formal clinical studies, 3 so far, and that's involved approximately 200 patients. The most extensive of these studies is one that we performed specifically for the FDA application, and this involved 110, 111 patients, where what we did was we asked the investigators, so this was 5 clinical investigators, asked to identify teeth with lesions that they felt had an active activity associated with the lesion. And we then asked them to image them using the Calcivis imaging system and highlight on the visible image. So they didn't see the luminescent image, they only saw the visible image, highlight on the image where they felt that activity was. And then what we did, we asked a second independent investigator to look for correlation between the luminescence and the original area that the dentist had highlighted. So this was done with a number of positive teeth, and we also included control negative teeth in there as well. The result of these clinical studies were, very importantly, there were no adverse reactions, nothing associated with the photoprotein on the device itself, which is excellent. And we also found a very, very good correlation between the dentist's original expectations for active lesion and the luminescent signals. We found a 91% correlation for active lesions, and importantly we found a 98% correlation with the sound tooth surface. One of the key benefits of the Calcivis imaging system is patient communication. And I had a lovely story from one of our beta testers who had a 16-year-old female, came into the surgery. She had no medical history, but was at risk because she had just had brackets removed. And she was on her mobile phone the whole time. She came into surgery on a mobile phone, sat in a chair, was still on a mobile phone. The beta tester asked if you could use this new device on her. She was quite happy for it to go ahead. And the images were taken. As soon as they came up on the screen, she was fascinated. She put her phone down, she looked at the screen and she said, "Was that my tooth?" And I said, "Yes, that's your tooth. And what's that bit there?" And that's where there's decay going on. Ooh, didn't know about that. So she was immediately engaged. She was interested in what treatment the dentist wanted to do in this case. And particularly, it was non-invasive. He didn't want to drill it. He was just looking to put a sealant on there and ask her to take particular care in that area. And at the end of the process, she asked for a copy of the photo to go on her Facebook page. And she said, "You can have it as long as you come back in 3 months' time and we take another one and show an improvement, and you have to promise to put that one on your Facebook as well." Calcivis imaging system provides an on-screen, real-time demineralisation map of the tooth surface, and it does this all within less than a second. This allows the healthcare professional to take a preventive approach to treatment. It also gives an opportunity for monitoring any therapies that's been prescribed. And very importantly, it's a very powerful and impactful communication tool to help drive patient commitment and compliance.